As women move from their 20s to their 30s, they want to be watching what they're eating, because usually a lot of patients are talking about that they're gaining weight and they're not understanding why. As you get older and into your 30s, your metabolism slows down and you start now having some problems. So you want to watch what you're eating, exercise more, at least 3 days a week, get in some cardio. The other thing people start realizing is that they're having some fertility issues. Most women in their 20s and in their teens, they're on birth control, and all of a sudden now it's time to start family planning. And they're noticing that it's a little bit harder than what it was before. So if you start having a problem with that, come to your doctor and actually start talking about that so that we can figure out a plan for you. A lot of the birth control, what we say is that within 3 months it should be out of your system, depending on which one you had. If you had one of the long-term birth controls, then it may be in your system for a little bit longer, but usually once we take it out, you want to be aware that you could be getting pregnant within the next month. We still check people if they come in and ask about gonorrhea and chlamydia testing and any of the blood testing for HIV, syphilis, anything like that. Universally, we don't just test for those unless we talk with our patients and find that they have risk factors for having sexually transmitted infections. With the HPV, the human papillomavirus, we've actually started testing all of our over 30 patients in their pap, because what we found is that co-testing with human papillomavirus and the pap smear, if they're both negative, you can actually go longer before you need another pap. So instead of it being every 1 year, which is what everybody thought, it can now go to every 3 years if they were both negative. The other thing we like people to be aware of is, even though we're saying that you should actually have a pap smear every 3 years, that does not mean you need to stop visiting your physician until every 3 years. You need to come back every year and get a GYN exam, a regular family practitioner exam as well, because the family practitioner will actually be doing your cholesterol, your glucose testing for your diabetes test. They'll be checking your blood pressure, things like that. In your 30s, you should be giving yourself a self-breast exam every month, usually right after your period. We tell patients after your period to actually be doing your exams and doing it every month, and if you ever find anything, you want to talk with your physician about it. For your clinical breast exams with your physician, that should be done once a year. So again, even if you're not coming in for a pap smear, you need to come in for your clinical breast exam. To think about in your 30s is also prevention is the key, okay? You've come from your 20s and now things are changing, so you want to make sure that you are getting your preventative exams. Get your eyes checked, go to your dental exams, and also get your flu shot every year.